Today we're talking about the most common type of low back pain, referred to as stenosis. Stenosis is also known by other names, most commonly arthritis, and the big scary one is degenerative disc disease. Each segment of the spine, there's a hole where the nerve comes out, and that hole starts to get narrow as we age. I have a really easy test that I can give you right now that'll help you understand whether or not your back pain is related to stenosis. It's very easy. It's actually 4 questions. If you answer all yes to these 4 questions, there's a 97% chance that you actually have stenosis as the type of back pain. Are you over the age of 50? That's number 1. So do you have 50 birthday candles on your birthday cake? Number 2 is, do you have pain in your back when you're standing? Do you have pain in your back when you're walking is number 3. And then finally, does that pain go away when you sit down? If you answer yes to all 4 of those questions, research and science indicates that there's a 97% chance that that's actually the type of back pain. But also, we'll have pain in our lower back, but also that pain oftentimes will travel down our leg. And we'll get pain, sometimes even numbness and tingling. That's referred to as sciatica. Stenosis-related back pain can actually create sciatica, which is typically pain traveling down the back of the leg, as well as sometimes numbness and tingling, and even sometimes weakness. Your leg can give out on you, or you can feel muscles that are getting weak. Sometimes your leg will just feel heavy while you're having back pain. So those are the symptoms of stenosis. Let's talk about the common cause. So again, there's a difference between the common cause and the type. We know what the type is. We already talked about the type. But we know that that hole is dynamic. So when you're moving, the hole is either opening up or closing down. So the movements that make the hole close down are actually the key. And there's a really, really common area in the body that causes that hole to close. And it's actually a muscle in the front of the hips, which you can see right here. That muscle is called the hip flexor. The name doesn't really matter, but where it's at is really important. So you can see that it sits in the front of the hip, but it actually comes from the spine. So you see how it's attached to the last 5 segments of the spine. That's the lower back. And then it goes all the way down and it wraps to the inside of the hip. So right now when you're watching this show, you're watching me, you're sitting there, and that muscle is totally relaxed because you're in the sitting position. And it's doing nothing. When you go to stand up, however, that muscle gets tension. And when the muscle has tension, it starts to pull on the spine. It pulls the spine forward. And if that muscle's tight, because we've sat too much, which is really common, by the way, we sit so much these days. I think the average was 10 hours a day the last time I looked at a study on that topic. That muscle starts to get really, really short and it loses flexibility. When you stand up, that muscle pulls the spine forward. Pulling the spine forward is the same thing as the spine bending backwards. Bending backwards actually closes down that hole. So that muscle can become a big problem. And now, not to mention, when you take a step forward and you have one leg behind you, that muscle really has to lengthen. It has to maximally lengthen in order for you to take a step forward and then the next foot goes forward. That really starts to pull on the spine, even more than just standing. You've got a lot of people that are out there, they're not having any pain. They get the MRI or the X-ray, and what they found was the majority of people that are living without pain have stenosis or arthritis or degenerative disc disease, which is again all the same thing, they're just called different names. It's aging of the spine. The majority of people that are walking around on earth have this in their spine. In fact, you can see the table here. Here's our numbers. You're focusing on the top column here, which is the disc degeneration, which again is arthritis. We know that 80% of people over the age of 60 are walking around with this in their spine without any pain. The reason that they're able to live without pain is because they have good mobility in this muscle. This muscle doesn't have tightness. They're able to stand, they're able to walk, and that muscle doesn't pull on the spine and it doesn't cause the hole to close down, so they're able to live pain-free. I see people in the clinic as a physical therapist very commonly will tell me they've had back pain for months, for years, even 10, 15, 20 years. They ask me, well, when should I have come in and seen you? And I always kind of say, gosh, there is really actually a pretty scientific answer when it comes to that question. And it's really based on the science of healing. Phase 1 of the healing process, here you can see, is called hemostasis. That takes about 1 to 3 days. Phase 2, however, is called the inflammation phase. That lasts from about 3 days to 20 days. A lot of times we're actually treating inflammation in order to relieve our pain. maybe isn't the best idea. In fact, there's studies now that show that treating inflammation only actually delays the healing process. Things that would help us treat inflammation might be like ibuprofen or aspirin. Injections in the spine will oftentimes treat the inflammation that's occurring. And yet it's the second phase of healing, and it lasts between 3 and 20 days depending on how much damage there is to the tissues inside of our body. The phase 3, which is granulation, and phase 4 here, which is maturation, which can take a minimum of 6 weeks and can last up to 2 years. So if you're struggling with pain in your back, or you again have that sciatic pain that travels down the back of your leg, oftentimes that's going to be pain, numbness and tingling, sometimes even weakness. There's a really good chance that in the next 4 to 6 weeks it's going to go away on its own if the thing that was causing the hole to close down and the damage that's occurring is not there anymore. That's really the trick. If we're only treating inflammation, it will delay the healing process. And if you're trying to wait it out and let your body heal on its own, you should really be thinking about somewhere between 4 to 6 weeks. If it's not getting better, you should consider seeing somebody that's going to be able to address the movement-related pain. That's the key. So physical therapists are the movement experts. We're going to help you identify the movements that are closing the hole down. We're not just going to mask the symptom of pain by treating inflammation. We need to address the thing that's causing the hole to close down. This quick tip is going to be a strategy on how to relieve the symptom of pain quickly. It doesn't treat the problem long term, but it relieves the symptom of pain quickly. Remember earlier in the segment we talked about when you have stenosis in your spine or arthritis, the hole starts to become, the diameter of the hole becomes smaller because we're aging. But also remember, as we move, the hole can open or close. So a way to relieve pain quickly is to open up the hole. So I'm going to go ahead and grab a chair. Any chair will be fine. I'm going to sit on the front edge of that chair and simply flex forward, which is going to open up the hole. So a really neat strategy to decompress the nerve. So feet are shoulder width apart. We're going to gently reach down towards the ground. There is no requirement for how far you go. We just want to gently reach back and forth for about 45 seconds. If it feels better just to hold it, you can hold it as well. So 45 seconds, 2 or 3 times, maybe even 2 or 3 times a day, and you should start to notice some relief of the pain. And for our next tip, I'm going to show you how to reduce the movements that are causing the hole to close down. If you can remember earlier in the show, we talked about the muscle that lies in the front of the spine, and it actually attaches to the hip. And right now that muscle's totally relaxed. It's called the hip flexor, by the way, if you remember. But when you stand up, that muscle gets tension, and when you take a step forward, that muscle gets even more tension, and it pulls the spine into an extended position, which closes down the hole. So I'm going to teach you how to gain some flexibility in that muscle. So real easy, we're going to take that same chair that we were just using. Now, you can use a stairway or a chair. We just need something to get your foot up on. So here I am. I'm going to take one foot. I'm going to put it up on the chair. Right away, I notice I need a little bit of stability to hold on to. So by all means, if you're at home and you're trying this, I want you to have your hands on a table or a wall or another chair. You have to make sure you're safe, number one. Number two here, we've got the distance is like a big step forward, okay? Stairway works really good. This back leg is nice and straight. The foot is also straight. And we're going to gently take our body and move our pelvis forward. Right away, I start to feel tension right in the front of this hip. Well, guess what? That's the hip flexor. That's the muscle that's pulling your spine when you're having pain in your back from standing and walking. This is a natural way to relieve that tension. So we're going to try 30 seconds moving our hips front to back. Then we're going to move our hips a little side to side, 30 seconds. And then the last one is my favorite. We're going to go around in little circles. Of course, I'm going to do this on both sides. It takes about 1.5 minutes each side. And if you do this one 2 or 3 times a day, you're going to notice that walking starts to become less painful in your back. You're going to get relief of that sciatic pain naturally without medications, injections, and surgery, which is the name of the game. So if you're out there suffering with back pain, and today's show made you realize it's probably stenosis related or arthritis, give us a call. We have several low back pain specialists here at Superior Physical Therapy. There's no reason that you should have to suffer with your back pain, especially if it's been going on more than 4 to 6 weeks, as we talked about earlier in the segment. I'm Dr. Andrew Gorecki, and let's get you back to pain-free living.